Question 1. While setting up to do a sterile dressing change, the nurse places sterile 4x4 gauze pads on the sterile field, but then the nurse accidentally touches the field with an ungloved hand. Which action should the nurse take? B. Discard the field and gauze pads and start over. If a sterile field becomes contaminated, everything must be replaced. When setting up a sterile field, the area must be clean and dry. The nurse uses clean gloves to remove the old dressing and sterile gloves to apply the new dressing. The other options are absolutely incorrect. Question 2. The nurse is educating a client who is to receive brachytherapy for a diagnosis of prostate cancer. Which of the following instructions should the nurse include? C. Children under age 18 and pregnant women may not visit the client. Brachytherapy, also called internal radiation, is a treatment for cancer, especially prostate cancer. Other cancers that are treated with brachytherapy include cervical, uterine, breast, head and neck, gallbladder, lung, rectal, and eye. Sealed radiation is placed inside or next to the area that requires treatment. This allows a higher dose of radiation in a small area for less time than other radiation therapies. Federal regulations prohibit children under 18 and pregnant women from visiting the client. Visitors must stand 6 feet away and may not spend more than 2 hours a day with the client. The client is confined to a private room, with limited care by staff. Question 3. A client is being discharged to home with a small MRSA-infected wound. When the nurse provides instructions for the family, which of the following is true to prevent transmission to other family members? B. Use a separate towel and washcloth. MRSA stands for methicillin-resistant and NBSB, Staphylococcus aureus, a type of bacteria that is resistant to several antibiotics. Most staph germs are spread by skin-to-skin contact. They can also be spread when you touch something that has the staph germ on it, such as clothing or a towel. To prevent spreading the infection, the wound should be covered with clean, dry bandages until healed. Do not share personal items such as towels, washcloths, cosmetics, or razors. Plasticware is not necessary. Home treatment usually includes a 7 to 10 day course of antibiotics for the client, not others in the household. Question 4. When a client with a diagnosis of rheumatoid arthritis, RA, comes to the clinic for a routine checkup, the nurse observes several bruises on the client's arms and legs. The client tells the nurse, "I seem to get a bruise every time I bump into anything." The nurse will expect to see a decrease in which lab value? C. Platelets. Some autoimmune diseases, such as rheumatoid arthritis, RA, systemic lupus erythematosus, SLE, Hashimoto's thyroiditis, and Evans syndrome can cause the platelet count to drop below normal levels. The body uses or destroys platelets faster than they can be produced, causing bruising to occur more easily. Thrombocytopenia is a low platelet count, with signs and symptoms that include easy or excessive bruising, prolonged bleeding from cuts, bleeding from the gums or nose, blood in the urine or stools, heavy menstrual flows, and fatigue. The other answer options are not related to clotting. Question 5. A home health nurse does an assessment of a client with mid-stage Alzheimer's disease who lives with his son and the son's family. Which of the nurse's observations should be addressed first? A. The front door has a lock with a bolt. The family seems to have taken measures to keep the client safe. However, doors need to have locks in atypical locations, such as the top of the door, to prevent the client from wandering when confused. Conventional locks can easily be opened. Question 6. The nurse is giving a presentation on home safety and fire prevention. Which of the following is the first action to take in preparation? B. Replace smoke detector batteries twice a year. A home safety fire plan starts with functioning smoke detectors. Smoke detectors activate before an open fire, providing precious time for evacuation. Check smoke detectors monthly and change batteries twice a year, such as when the clocks change. Fire drills and fire extinguishers are appropriate but not the first action. A home sprinkler system is expensive. Question 7. The nurse is caring for a client with a right brain stroke with accompanying unilateral neglect, hemineglect. Which of the following actions is most appropriate? C. Approach the client from the left side. Unilateral neglect is a lack of awareness of the side that was affected by the stroke. For a right-sided stroke, the client will have left-sided deficits, and in this case, no awareness of the left side. Helpful actions include approaching the client from the neglected side, placing a chair and bedside table with belongings on the neglected side, holding the neglected hand, and including the neglected hand in daily tasks. Saying "look to the left" or "where is your glass of water?" is not helpful. However, place the call light on the strong or unaffected side so that the client can use it easily. Question 8. The nurse is giving a presentation to a volunteer group on proper use of alcohol-based hand sanitizer to help prevent transmission of COVID-19. All of the following statements are true except B. Rinse or wipe off excess hand sanitizer to avoid spills. Proper use of alcohol-based hand sanitizer includes using a minimum of at least 60% alcohol, covering all hand surfaces with the sanitizer, and rubbing hands together until they feel dry, about 20 seconds. Hand washing with soap and water is always preferable, because it removes all pathogens and chemicals. Question 9. The nurse in the birthing and maternity unit is training new unlicensed assistive personnel, UAP, on standard precautions. Which of the following observations by the nurse would indicate the need for further instruction? B. The UAP uses sterile gloves to bathe a neonate who is 4 hours old. There is no need to wear sterile gloves to bathe a neonate. Clean gloves are sufficient. Sterile gloves are expensive and unnecessary. The other options are appropriate actions for taking standard precautions. Question 10. A client presents to the emergency department with a wound that has jagged and irregular edges. The nurse should document this injury as C. A laceration. A and NBSB, laceration and NBSB, is an open wound that is produced by the tearing of soft body tissue. This type of wound is often irregular and jagged. It is often contaminated with debris from the object that caused the injury. An abrasion is a superficial wound that occurs when the skin scrapes against a rough or hard surface. An avulsion is partial or complete tearing away of skin and tissue, usually caused by violent injury. A contusion, bruise, is a closed wound caused by a blunt object that causes bleeding beneath the skin. Question 11. The nurse is providing care for a client being treated with a sealed radioactive source implant. Which of the following actions is unsafe? C. Assign one nurse to care for the client. When caring for a client being treated with a sealed radioactive source implant, limit radiation exposure by rotating non-pregnant staff members. All staff should wear a radiation monitoring badge and spend minimal time in the client's room, especially providing bedside care. A universal radiation sign and specific stay times should be posted on the client's door. Housekeeping should not enter the room unless escorted by a nurse, and only essential cleaning should be done. Laundry is placed in a designated container and saved until surveyed by the hospital's safety or health physics team. Question 12. The pediatric nurse is preparing to administer a medication to a 3-year-old patient. Besides checking the child's armband, the nurse should also B. Ask a parent to identify the child. Young children are at risk for medication errors because they can't communicate. They may not know their full name, or they may be accustomed to being called by a nickname that is not on the ID band. Knowing how old they are is not adequate. Birth dates are required. Parents may be used as the second source of identification. Parents are not asked to leave their child. In some hospitals, the nurse can allow the parent to administer the medication to the child. Question 13. A client receiving total parenteral nutrition, TPN, has a routine glucometer check, with a result of 350 mg per deciliter. Which of the following is the nurse's best action? B. Notify the provider for glucose control. TPN is often accompanied by hyperglycemia, because the base solution is 10 to 20% glucose. This client requires some type of glucose control to prevent intravascular injury and hyperosmolar crisis. The other actions are inappropriate and do not resolve the cause of the high glucose level. Question 14. A client comes to same-day surgery for a minor procedure. Which of the following is most important for verification of the client's identity? B. Identification bracelet. The most important step is to place an identification bracelet on the client. All healthcare staff will refer to the bracelet throughout the entire procedure. The admitting record and addressograph labels are also necessary. The client's driver's license is not part of the identification process. Question 15. As the nurse completes a routine preoperative checklist before transporting the patient to surgery, the patient tells the nurse about an allergy that is not on the health record. What should the nurse do first? B. Contact the anesthesiologist. The anesthesiologist and the nurse anesthetist must have all available knowledge about the patient's medical information, because they monitor the patient's physical condition during surgery. If any new information becomes available prior to transporting the patient, a direct call to the anesthesiologist is required to ensure patient safety. Question 16. What is the first priority in preventing transmission of infections? C. Performing proper hand hygiene. Hand washing and NBSB remains the single most important way to avoid spreading and getting infections. All too often, nurses don't practice good and NBSB, hand washing and NBSB, techniques and don't teach patients and families how to perform proper hand hygiene. Nurses should wash their hands before and after every patient encounter. Question 17. During new employee orientation, the nurse provides information about exposure to bloodborne pathogens and the risk of human immunodeficiency virus, HIV, transmission. Which statement by the nurse is most important? A. Report any possible exposure of HIV-containing fluids immediately. Possible exposure to HIV-containing fluids should be reported immediately. According to the Centers for Disease Control and Prevention, CDC, after exposure to HIV, prophylactic treatment with antiretrovirals should be started as soon as possible. Optimally, treatment begins within hours of exposure. The other statements are true, but not the most important for educating new employees. Question 18. A client is being admitted to the unit with a diagnosis of rule-out Leynick's cirrhosis of the liver. During the initial assessment, the nurse observes that the client is constantly scratching their skin. The nurse knows that this pruritus is the result of B. Accumulation of bile salts. Leynick's, or portal, cirrhosis is primarily caused by excessive and NBSB, chronic and NBSB, alcohol consumption. The relationship between alcohol and cirrhosis is unquestioned, but the mechanism of injury remains unknown. Itching, pruritus, is caused by the buildup of bile salts related to faulty processing of bilirubin. If bilirubin levels are high, substances formed when bile is broken down may accumulate. Reduced or loss of phagocytic activity leads to infection and possibly bacterial peritonitis. Ascites is caused by liver scarring, which increases pressure in the liver's blood vessels and forces fluid out. Although the liver produces cholesterol, this is not the cause of the client's pruritus. Question 19. When a post-operative client becomes confused and agitated, the nurse contacts the healthcare provider, HCP, and obtains a prescription for bilateral wrist restraints. Which of the following actions can be appropriately assigned to an LPN/LVN? B. Release and reposition restraints for client comfort. It is within the scope of LPN/LVN practice to release, remove, and reposition a client's restraints. Assessment, evaluation, and education are RN responsibilities. The RN is also responsible for contacting the HCP and maintaining communication and documentation regarding the need to continue to use restraints. Question 20. Following an uncomplicated surgery, the healthcare provider, HCP, orders a client's peripheral intravenous, 4. Line to be discontinued. Which of the following actions by the nurse is most important? A. Don clean gloves before starting. When removing a peripheral for line, the nurse should first gather supplies, perform hand hygiene, and don clean gloves. Unless the client is on anticoagulants, pressure is only necessary for about 2 to 3 minutes. Vital signs are not indicated after discontinuing and 4. There should be little or no blood loss from the procedure. Question 21. A client with a foot ulcer is admitted to the medical unit with vancomycin-resistant Staphylococcus aureus, VRSA. Which task is appropriate to assign to an LPN-LVN? A. Obtain wound culture with aseptic technique. It is within the LPN-LVN scope of practice to obtain specimens for culture. They are also trained in principles of infection control, including aseptic technique. Depending on the state of licensure, they may also perform sterile dressing changes. The other options are RN responsibilities. Vancomycin and NBSB has been regarded as the first-line drug for treatment of and NBSB, MRSA. However, enterococci bacteria can become resistant to the drug. VRSA can cause an illness from skin infections to severe invasive disease which can result in pneumonia and/or septicemia or even death. Question 22. A nurse's neighbor calls in a panic to tell the nurse that her 2-year-old son has just eaten a detergent pod. What should the nurse tell the mother to do first? B. Call the poison control center. With any possibility of poisoning, always call the poison control center for instructions. 1-800-222-1222 is available 24 hours a day. Vomiting is not always recommended, and it can be harmful. The other 2 answer options can waste valuable time. Question 23. Space are the most common cause of accidents in the home? B. Falls. According to the National Safety Council, falls are the number 1 cause of home accidents. For persons aged 65 and older, falls are the leading cause of injury-related deaths, including broken hips. Many falls can be prevented with simple measures, such as wiping up spills and removing small rugs and clutter. Question 24. The nurse is caring for an 84-year-old client with a stage 2 pressure ulcer on the coccyx. Which of the following is an appropriate action? C. Reposition the client every 2 hours. A stage 2 pressure ulcer is partial thickness skin loss involving the epidermis or dermis. The skin breaks open, wears away, or forms an ulcer, which is usually tender and painful. The nurse should relieve the pressure on the wound as well as protect it. The client should be repositioned every 2 hours, and the head of the bed should not be elevated more than 30 degrees. The ulcer should be covered with a protective dressing. Daily cultures are not indicated unless ordered by the provider. Question 25. Which of the following is an early symptom of gonorrhea in males? B. Urethral discharge. Gonorrhea is an infection caused by the bacterium Neisseria gonorrhoeae. The symptoms of gonorrhea generally appear within 7 to 10 days after exposure. In males, one of the early symptoms of gonorrhea is a profuse, purulent discharge from the penis. Other symptoms are a burning sensation when urinating, increased urgency and frequency of urination, swelling or redness at the urinary meatus, and pain or swelling of the testicles. The other answer options are not related to gonorrhea. Question 26. What precautions are necessary when caring for a patient with hepatitis A? C. Wearing gloves for direct care. Hepatitis A is transmitted by the fecal-oral route. Unlike hepatitis B and C, it is self-limiting and does not cause chronic liver disease. Contact precautions are recommended for patients with hepatitis A. No private room is necessary unless the patient is incontinent of stool. Question 27. A neighbor brings her 10-year-old son to your house because he has a nosebleed. After you sit him down, what is the most appropriate way to care for him? C. Lean him forward and gently pinch above his nostrils. To stop a nosebleed, sit down and pinch the soft part of the nose, just above the nostrils. The bleeding should stop in 10 to 15 minutes. Leaning forward while doing this will allow the blood to exit by the nose, instead of down the throat. Tilting the head back can cause nausea. The other two answer options are incorrect. Question 28. If a nurse is assigned to care for a patient with a Sengstaken Blakemore tube, which item must be kept at the patient's bedside? B. Scissors. A Sengstaken Blakemore tube is a medical balloon device inserted through the nose or mouth and used in the management of upper gastrointestinal hemorrhage caused by esophageal varices. If the tube ruptures, scissors are used to cut the balloon and prevent blocking the patient's airway. A hemostat is used to clamp blood vessels or tubing, because it can lock. A Yankauer is used for oral suctioning. Sutures are for wound closure. Question 29. If the nurse realizes that a patient has received the wrong medication, what is the nurse's first action? C. Assess the patient's condition. After recognizing that a patient has received the wrong medication, the nurse should first assess the patient for any complications or side effects. The patient's safety comes first. Reporting the error and completing an incident report can come later. Question 30. The nurse is providing discharge instructions to a client who was admitted with a diagnosis of acute pancreatitis. Which of the following statements by the client would indicate that the client understands how to prevent another episode? A. I will attend Alcoholics Anonymous meetings from now on. Pancreatitis can present as either acute pancreatitis or chronic pancreatitis. Acute pancreatitis is a sudden inflammation of the pancreas. Two common causes are alcohol abuse and gallstones. The pancreatic acinar cells metabolize alcohol into toxic byproducts that damage pancreatic ducts, and enzymes that are normally released into the digestive tract build up and begin to digest the pancreas itself. The damaged pancreatic tissue promotes inflammation, which leads to further damage of the pancreas. Clients with a history of alcohol abuse should stop all alcohol intake. Therefore, the appropriate client response here is the commitment to attend Alcoholics Anonymous meetings. The other responses are unrelated to acute pancreatitis. Question 31. The emergency department nurse attends a training on treatment of clients who are contaminated with anthrax during a bioterrorism event. If a client presents to the ED with possible anthrax contamination, which action should the nurse take first? C. Initiate decontamination protocols. With suspected anthrax contamination, decontamination protocols are the priority, placing the client away from others, removing and destroying clothing, and showering the entire body. Standard contact precautions: gown, gloves, mask, and secretion precautions, special handling of any possible items, such as excretions, drainage, or dressings, are necessary. Antibiotic therapy is initiated with symptoms. Oral ciprofloxacin, levofloxacin, or ofloxacin are standard. Notifying local and national health authorities is mandatory, but not the immediate action. A vaccine, Biothrax, is available, but limited to certain situations and not kept at hospitals. Anthrax is caused by Bacillus anthracis, a gram-positive rod that forms spores. It is a disease of herbivore animals, such as cattle, horses, sheep, and goats. However, it can be used as a biological weapon. Question 32. A 6-year-old child is admitted to the pediatric unit with suspected pertussis. What is the nurse's first intervention? A. Initiate droplet precautions. Pertussis, whooping cough, is a highly contagious respiratory disease caused by the bacterium Bordetella pertussis. Symptoms include uncontrollable, violent coughing, which often makes it hard to breathe. After a coughing fit, someone with pertussis often needs to take deep breaths, which result in a whooping sound. Droplet precautions must be taken to prevent contact with mucus and other secretions from the nose and sinuses, throat, airways, and lungs. Illnesses that require droplet precautions include pertussis, mumps, influenza, flu, and other contagious respiratory illnesses, such as those caused by coronavirus infections. Anyone who enters the room of a patient with a contagious respiratory illness should wear a surgical mask. Question 33. After 2 students in 4th grade are diagnosed with pediculosis capitis, the school nurse prepares to send an alert to parents. Which instruction should the nurse include? C. Avoid sharing helmets for football practice. Pediculosis capitis, head lice, and NBSB, is an infestation of the eggs, larvae, or adults of lice. The crawling stages of this insect feed on human blood, which can result in severe itching. This infestation is spread by close contact or sharing hats, headgear, combs, or brushes with other children or family members. Adult lice rely on blood several times a day to survive. They cannot live more than 48 hours without blood. Sharing crayons or school items or swimming in a pool with others does not spread infestation. Question 34. While the nurse is administering COVID-19 vaccinations at the clinic, a client asks about hand washing versus using hand sanitizer in the community. The nurse explains that washing with soap and water should be done for all of the following except C. Visiting a friend in a nursing home. Hand washing will remove all types of germs from hands, but hand sanitizers are not able to kill all types of germs or remove harmful chemicals like pesticides and heavy metals. Wash with soap and water for at least 20 seconds if hands are visibly dirty, before eating, and after using the restroom. And NBSB. Hand sanitizers are appropriate for other situations, and if hand washing is not available. Hand sanitizers should contain at least 60% alcohol. Question 35. During a code for an unresponsive infant, which pulse location should the nurse palpate? A. Brachial. For an infant, the best place to check for a pulse is the brachial artery. To locate the brachial artery, place 2 or 3 fingers on the inside of the upper arm between the shoulder and elbow. Press the fingers gently for 5 to 10 seconds to feel for a pulse. Pushing too firmly may occlude the infant's pulse. Because of fatty tissue around an infant's neck, the carotid artery can be difficult to locate. Pedal and radial pulses are unreliable. Question 36. A nurse entered a client's room and found the client on the floor. The nurse is now completing an incident report. Which information should be documented in the report? A. The client was found on the floor. An incident report should only contain the facts as observed by the nurse. The nurse should avoid adding subjective details or interpreting information. The report should also contain the client's name, age, diagnosis, and other facts required by the hospital or agency. Question 37. A 2-year-old girl is admitted for 24-hour observation after she fell from her crib onto her head. The pediatric nurse should call the provider to report which of the following: B. Rise in temperature from 99.2 degrees Fahrenheit to 101.6 degrees Fahrenheit. Normal pulse for a child 1 to 2 years of age is 80 to 130 bpm. Normal respiratory rate for a child 1 to 3 years of age is 24 to 40 per minute. Normal systolic BP for a child 2 to 6 years of age is 70 to 106 mm of mercury, and normal diastolic BP is 25 to 65 mm of mercury. A child is considered to have a fever when the child's temperature is 100.4 degrees Fahrenheit 38 degrees Celsius or higher, measured rectally. The nurse should notify the provider about the child's temperature, whether or not it is related to the fall. Question 38. When you are caring for an indwelling urinary catheter, which of the following nursing interventions to prevent infection is correct? B. Disinfect the sampling port before obtaining specimens. According to the Agency for Healthcare Research and Quality, HRQ, interventions to prevent infection in an indwelling urinary, Foley, catheter include the following: practice proper hand hygiene and use gloves, empty the collection bag regularly, or at least once every shift, use mild soap and water to gently clean the periurethral area, do not change the catheter and drainage bag at fixed intervals, Disinfect the sampling port before obtaining specimens, and label the drainage bag with the client's ID and the date. Question 39. According to the CDC guidelines on hand hygiene, nurses who have direct contact with high-risk patients should not wear artificial nails, because the nails A. Can transmit gram-negative pathogens. Nurses who work in critical care units or have direct contact with high-risk patients can transmit infections to patients. Subungual areas of the hand harbor high concentrations of bacteria, most frequently coagulase-negative staphylococci, gram-negative rods, including Pseudomonas spp, Corynebacteria, and yeasts. Studies have shown that even with aggressive hand washing, artificial nails are difficult to clean. Question 40. A right-hand patient is groggy and confused after surgery. The patient keeps pulling at the four inserted into his left arm. What is the least restrictive restraint to maintain the foresight? D. Safety mitt for the right hand. A single safety mitt permits arm movement while preventing the patient's hand from grasping the foretubing. The Joint Commission Standard PC.03.05.01 states that restraints may only be used when less restrictive interventions are ineffective and the restraints are discontinued at the earliest possible time. Question 41. The entire staff attends a mandatory in-service on the use of anthrax in bioterrorism. Which statement by a staff member indicates the need for further instruction? D. Anthrax produces a neurotoxin that causes paralysis. Anthrax is an infection caused by the bacterium Bacillus anthracis. It can be spread by direct or indirect contact with sick-hooved animals. It is transmitted by inhalation or skin wounds or through the digestive system. Botulism, caused by a neurotoxin from the bacterium Clostridium botulinum, causes paralysis, which can be fatal. Question 42. A patient is admitted to the unit with an order for seizure precautions. Which action is most appropriate? D. Maintain the client's bed in the lowest position. To protect a client with a known or suspected seizure disorder, the bed should be kept in the lowest position to reduce the chance of injury from falling onto the floor during seizure activity. Question 43. The nurse is assessing a patient who is recovering from a recent stroke. Which of these problems is the first priority? D. Risk of aspiration. ABC stands for airway, breathing, circulation. For every patient, these are the priority. For this patient, the first problem to address is the possibility of aspirating and choking. The other problems can be taken care of after the airway and breathing are secure. Question 44. Which of the following is the second period or stage of the infection process? D. Prodromal. After the initial entry of the pathogen into the host, the first period of infection is incubation, when the pathogen begins to multiply. The prodromal period is when the host begins to display signs and symptoms and the immune system activates. The period of illness occurs when signs and symptoms are most obvious and severe. The period of decline is when the number of pathogens decreases and signs and symptoms resolve. During the final period of convalescence, the body returns to normal. Question 45. After an elderly home health client moved in with a family member, the nurse makes a routine visit and notes that the client has large, fresh bruises on the legs and arms. Which observation best indicates that the client is a victim of elder abuse? D. The reasons given for the client's bruises are inconsistent. The most suspicious finding is the conflicting stories about the cause of the client's bruises. A home health nurse cannot draw conclusions from a client's home that does not meet the nurse's personal standards. An unclean home is not sufficient evidence of abuse. Not having a private bedroom is unfortunate but not necessarily suspicious. The cause of the client's weight loss should be investigated at a later time. Question 46. Before the nurse sends a client for a CT with contrast dye, what is the nurse's most important action? D. Check the client's health record for allergies. It is most important to ask the client about allergies and check the client's health record for allergies. Contrast dye contains iodine, which is related to shellfish allergies. Question 47. A female client arrives at the clinic with a cough and fever. All exam rooms are full, and other clients are waiting in the seating area. Which of the following actions is most appropriate? D. Give the client a face mask and seat her in a separate area. This client requires both standard and droplet precautions. The nurse should provide the client with a face mask and place her as far away as possible from other clients. A client who is ill should not be sent away or asked to wait outside. The nurse should maintain proper hand hygiene when interacting with all clients. Question 48. According to the Joint Commission, what is the fifth vital sign? D. Pain. Historically, pain was considered to be subjective, based on observation. In 2001, the Joint Commission designated pain as the fifth vital sign, meaning it should be measured, recorded and treated. Question 49. EMS transports a 21-year-old male following a motor vehicle crash. The client is subsequently diagnosed with a depressed skull fracture. While monitoring the client, the nurse observes tachycardia and hypertension and reports these findings to the provider. The nurse suspects which of the following? D. Internal injury unrelated to the skull fracture. The nurse suspects hypovolemia from an internal hemorrhage, indicated by the increased pulse and drop in blood pressure. Increased intracranial pressure, ICP, is indicated by a widening pulse pressure and slowing heart rate. A brain aneurysm is indicated by a sudden, extremely severe headache, double or blurred vision, seizures, and loss of consciousness. An anxiety attack is indicated by a sense of panic, feeling nervous, and difficulty concentrating. Blood pressure, pulse, and respiration rates may rise. Question 50. As the nurse prepares to administer ampicillin 500 mg PO to a post-op patient, he checks the capsule in the patient's medication box. The dosage of the capsule is not labeled, but the nurse is familiar with the color and shape. The nurse should D. Call the pharmacy to bring properly labeled medication. The nurse should never administer a medication that is not properly labeled, even if the nurse, or another nurse, recognizes it. The nurse should call the pharmacy to deliver a properly labeled medication. The nurse can handle the situation without contacting a supervisor.